We are live. We are live. We are live. I'm Dr. Frita, and welcome to Medical Monday, where we talk about all of the hot health topics in the headlines. Today, we've got so much to talk about. Let's talk about medical gaslighting. Yes, it seems like medical gaslighting is an epidemic where my colleagues, physicians, are making people think that certain diagnoses are in their heads when they're not. So we'll talk about medical gaslighting, and I want you to get your questions together and let us know if you've ever felt like you've been gaslit by a physician. And then we're going to talk about deli meat. Yes, we're talking about deli meat because the deli meat infection crisis is still going on. Boar's Head, in fact, they have done an even bigger recall. So we talk about how to keep yourself safe from the infection. We'll talk about the infection, Listeria, the signs, the symptoms, and what to do about this deli meat crisis, because y'all know y'all sit up there eating deli meat. And then we'll talk about the Olympics. Anyone been watching the Olympics in Paris? Yes, I know you have. Well, you know this is Medical Monday. And so we're not just going to be talking about the flips and Simone Biles and the swimming championships. No, we're talking about health, because there have been some health hazards during the Paris Olympics. So we'll talk about that. And then we'll talk about Pete Davidson, because he has admitted himself back into a wellness center for his mental health. And he's very open about that. And so we'll talk about his mental health diagnoses, how he copes, and what you can do to cope. And then, of course, my favorite part, the live Q&A. I'm answering your questions right here live and on stage. So get those questions together. Make sure you like and share this video, and come on back. We are live. We are live. Welcome to Medical Monday. I am Dr. Frita. This is Medicine in the News, talking about all of the hot health topics in the headlines. All the hot health topics in the headlines. I'm not doing it alone. My co-host and my practice manager for over a decade, Shador, will be helping me. Come on to the front of the class, Shador. How are you doing?
Doing pretty good. How are you?
I'm doing well. Did you have a good weekend, I hope?
Yes, I did.
Yeah. Did you check out any of these Olympics?
Of course. I mean, staying on top of all of it.
I know. I've been on a high. Yes. I've been on a high, but of course, sometimes I have to bring the people down a little bit with the reality of health. So we'll be talking about that in a little bit. But definitely, as you come on in, make sure you like this video, you share it to let YouTube know we're here and we're sharing evidence-based information. And again, make sure that you get your questions together, because we are having a live Q&A at the end of this discussion. So let's go ahead and get started. Raise your hand if you eat deli meat. Come on, y'all know y'all have had some charcuterie boards, y'all have some sandwiches, or you make the kids lunches. Deli meat, even though I talk about it as being an ultra processed food, and so there are certain kind of other things that are a little bit healthier, but so many of us have deli meats. Well, there's been a recall of deli meat, a lot of them because of a Listeria infection. And we came on here earlier, Shador, where we talked about a recall. And we had Boar's Head, who said that they were going to recall 200,000 pounds of meat. Well, guess what? The deli meat saga continues, because now they are recalling 7 million pounds of meat plus other products, including vegetables. We'll talk about it. Let's watch this clip.
Tonight, grocery stores around the state and nation are pulling millions of pounds of Boar's Head lunch meat from the shelves. Listeria has now been found in prepackaged, ready-to-eat meat. WJZ is live. Tara Lynch is in your corner, and she's outside the Baltimore City Health Department with what you should do if you feel sick. Tara.
Well, Nikki, this outbreak is affecting people and sickening people across several states. I spoke with a doctor at Johns Hopkins who says Listeria is treatable, but sometimes hard to diagnose. It can disguise itself, might seem like the common cold. I also spoke with shoppers near a local grocery store who said they might think twice before ordering from the deli counter right now.
I'm not going to be buying deli meats without thinking twice in the meantime.
Tons of various boar's head meats are off the store shelves after listeria was found in a liverwurst sample in Baltimore. Boar's head products made between early May and late July have been recalled because they may be linked to a nationwide outbreak of the bacteria. Boar's Head said in a statement it prioritizes safety. It expanded the recall to all products at its Jarrett, Virginia facility and paused ready-to-eat meat operations there. Patty Mead said she bought some liverwurst that ended up being contaminated.
I so seldom buy deli meat, and of course the first day I do, I get sick from it.
It's always hard in those early phases to know, is this someone's getting a cold or could this be listeria? So it is treatable, but obviously when it gets more advanced or involves the brain, or that is very serious.
The CDC says dozens of people have gotten sick across many states, including here in Maryland, and at least 2 people have died from the outbreak. If you consume contaminated meat, you could experience a wide range of symptoms, including fever, muscle aches, and vomiting. People who are 65 and older, pregnant, or immunocompromised are at higher risk.
Bacteria are everywhere in our environment, and this is just one that when we eat it as part of a food, we can become sick.
I feel pretty safe about buying food in the United States. I mean, you can never, some things always happen and you can never control that.
I'm not going to change anything, and by the next time I see some deli meat, I'm sure it'll be a whole fresh crop.
If you do have any products that are impacted by this recall in your refrigerator, just throw them away. Also, after you do that, make sure to wipe down your refrigerator because listeria can exist and grow in really cold environments. We have a full list of products that have been impacted by the recall on our website, WJZ.com. We're now reporting live in your corner in Baltimore City. Tara Lynch, WJZ.
All right. Shador, who was the first person in the chat today?
Yes, ma'am. Our first person today, I believe, was Miss Aline.
Hello, Miss Aline. Thank you for joining. All right, my good med heads in the chat. I want you, hello, how are you doing, Miss Aline? I want you to put a 1 in the chat if knowing about this recall and the possibility of getting listeria is enough to make you stop buying deli meat, or put a 2 in the chat if knowing this really doesn't move the crowd. If you're like, hey, I got to go of something, and you're just going to keep buying your meat and hope that they get it right. Put a 1 if this makes you want to stop buying deli meat or stop having your kids get the deli meat. 2 if you're like, hey, I'll roll the dice and we'll see what happens. All right, but let's go ahead and let's talk about listeria. So listeria is a bacteria, okay? And as we see, it can be found in deli meat, but it can be found in other places as well. So certainly deli meat or any surfaces that contaminated deli meat is on, it can be spread on. And initially, when they broke the story last month, they thought it was just literally in the freshly carved meat in the deli. It wasn't found in the pre-packaged meats. Now it's been found in pre-packaged meats plus other foods. And the other foods include, Shador, vegetables. Okay, they found it in squash. They found it in green beans. They found it in peppers. And so you really need to check it out because there is a long list of 71 products from Boar's Head, but also from some other places, Weir's Farms, Freshshire Farms. So make sure that you take a look, you look at the CDC, and you find out where there's been a recall. If you look up listeria recalls or deli meat recalls or Boar's Head recalls, you'll be able to find out in your area, because this listeria infection has been found in at least 23 states. Okay, at least 23 states. And we know at this point there have been at least 2 deaths. And so it's quite serious. So the thing about listeria is that in addition to it just being able to be spread from contaminated meat, it can also be spread if you drink unpasteurized milk, okay, unpasteurized dairy products, some soft cheeses. You can even get it in vegetables. Why? Because listeria is a bacteria that can be found in the soil. Okay, it can be found in the soil, contaminated feces, in rotting carcasses, okay, and even vegetation that is going into its demise. So it can be found in the earth. And so if you have vegetables that are coming out of that soil and they're not washed thoroughly, especially, then you can get listeria if you eat those vegetables, right? And the other thing about listeria, and this part is what's really scary, it can survive in really cold temperatures. So listeria can survive in refrigeration, Okay. It can even survive some freezing. So I know, so I want to see how many 1s and 2s I have now. Just because you freeze it doesn't mean the Listeria goes away. It's really quite fastidious. It can live in these really what one would think would be uncomfortable situations for bacteria. But I guess Listeria is the baddest one because it can live. The good news is that most people who get Listeria don't get very sick. Okay. And it's self-limited in most people, meaning they'll get some of the symptoms like fever, chills, headaches, and most people will get better on their own. The symptoms can occur after 1 or 2 weeks, but they can occur as early as a couple of days or even months. And so it's really tricky to pinpoint the Listeria infection. But here's something that's really important to know. Pregnant women are at high risk. People who are older than the age of 65, young people, infants. And even though these people who tend to be immunocompromised are at higher risk of getting the infection, even still, many and most even do live. But the real problem is with the unborn baby. So if a pregnant mother gets the Listeria infection, she may get a little ill, get some of these symptoms, but there's a great chance of her having a stillbirth or miscarriage. And so pregnant women need to be very, very careful. All right, Shador, did any of the med heads weigh in? Put a 1 if this story really makes you take pause in purchasing deli meats and these other food items. Put a 2 if you're just like, hey, y'all can't scare me. I'm going to buy whatever meat I want. Any 1s, any 2s?
Yes, a whole lot of 1s. I'll give a couple of 1s
right.
in the comments. So this was from 17 Studios. Hello.
I want 7 Studios.
17 says, I used to limit my intake. So definitely put a 1.
Good.
Arlene also placed the 1. Hi, Arlene.
Hi,
Arlene
Arlene.
says, seldom eat deli meat anyway.
Yeah, I'm not a big deli meat eater. I don't really like cold cuts, believe it or not. And yes, there are lots of reasons. Yes, it can have a lot of salt, be ultra processed, but just in general, I'm not a big cold cut person. So this doesn't make me cry for myself, but my kids, especially my youngest daughter, loves a good cold cut in her sandwich. So we have to have a discussion.
And then we have 1, 2 out of the bunch. Teresa.
Now, who's the 2? Who's this risk taker?
Teresa.
Hi, Teresa. Yeah. So, and it's interesting, Teresa, because if you play the number, so they released this story, at the end of July, and they're recalling meats like within a 6-week period, maybe from early May, I believe May 10th, all the way through July. And again, at first, there was a recall of 200,000 pounds of meat, then 7 million pounds of meat. And that, they make sure that they're very extensive and broad and wide. And so chances are they are being very, very safe, even, safe even beyond a point where they need to be. And so if you're a risk taker, okay, then you there's a great chance you'll be doing well. But I'm not trying to play. So I'm going to hold off with the deli meat to have my loved ones to hold off. But still just make sure you check out in case you're in one of those 23 states where people have been hospitalized, because that's the thing. 87% of the people who actually get the Listeria infection, show symptoms, 87% are hospitalized, 1 in 6 die. So it really is a serious infection. But yes, so we'll move on. But if you have any questions, you can go ahead and put your questions in. We'll hit the live Q&A at the end. And Shador, we've been getting more and more questions. And so we usually, Shador will just kind of go through and pick, the questions. But there's a lot of good questions that we have to pick through. And so if you want to make sure that your question is prioritized, if you put a little super chat, then that's one way to guarantee that we will get to your question. Other than that, Shador will pick. And unfortunately, there are a lot of good questions we just don't get to, but we will try. All right. Who has been, raise your hand. No, put a 3 in the chat if you've been watching and paying attention to the Olympics in Paris. Put a 3 in the chat if you've been paying attention to the Olympics. I know I have. And even prior, when they were kind of the hype of the Olympics, when all that was building up, we reported right here on this YouTube Live a story about Suni Lee. You know her, that gymnast who had kidney disease. In fact, she says she has 2 incurable kidney diseases. She gained over 40 pounds within a matter of 2 weeks. She had to quit or, temporarily pull back prior to going to the Olympics, and her fingers were so swollen due to the kidney disease that she was unable to perform initially prior to making the Paris Olympics. And then she showed up and showed out. Well, we talked about it here, but if you want more information, please go to my Instagram at dr.frita, where I did a short form video. I did a reel where I go into Suni Lee. And even though she hasn't revealed the exact name of her kidney disease or either of the kidney diseases, the symptoms she describes align very closely with something called nephrotic syndrome. So check out that reel. I have that over there on Instagram. Also on my Instagram, I did do a reel where I have some shots of Serena Williams, the tennis goat, of course, in Paris. She's fine, but her husband has Lyme disease. So I'll talk about Lyme disease. Make sure you check out Instagram. Give me a follow there because I have different content there than I have here on YouTube. All right. So now, yes, all the great things, USA is showing out. We've got our golds. We're doing well. But y'all know I have to talk not just about us doing well in the Olympics, but I have to talk about our wellness. So let's talk about some of the health hazards that are going on in Paris for the Olympics.
It was at 3:30 this morning. This water was tested again. The data showed risky levels of E. coli bacteria again. And it's no surprise the Seine is dirty. For a century, swimming was banned until the Olympics came here. But plans to promote Paris have turned to embarrassment. The men's triathlon postponed hours before it was due to start here. The sports boss blaming days of downpours.
It's unhealthy for the people who swim in the river.
If I was an athlete and it said it was dangerous today, it would be hard to have confidence it would be safe suddenly 24 hours later.
But we are taking care of that. We are not going to let them swim if the water is not good quality.
Do you apologize to all the competitors who've been disrupted?
Yes, of course. I mean, well, we don't feel that someone in this case has pain. We are not God.
There's daily analysis of the water quality.
We have 3 samples from 3 different locations that are being analyzed right now.
This lab contributing to the monitoring.
What is dangerous is that when you have sewage that overflows into the river, you get all the pathogens that are associated with it. So, it's not the bacteria we measure that are necessarily dangerous, but it is all the pathogens that are coming with it. And those could be viruses, other types of bacteria. They could be protozoa, etc. So this is where the danger comes from.
Okay.
Ahead.
All right. Do we have threes in the chat? Who has been watching the Olympics and keeping up with the Olympics? Let's throw a few out and then we'll talk about some of the health hazards. Shadori, I think you're on mute.
Oh, I am sorry. Knights has been watching the Olympics, keeping up.
Hi, Knights.
Diane.
I have 2 Diane.
Absolutely. Shadoria. Hello.
Oh, hi, Shadoria. Oh, I should have asked the favorite. I bet Shadoria. Oh, I bet yours is gymnastics. If y'all want to circle back through, put in your favorite. Mine is gymnastics, hands down, no question. But it's exciting. It's especially exciting when we're winning, and it's also exciting to hear those backstories. Who do you have here?
Theophilus. Hello.
Hi, Theophilus.
Because my wife has not missed a day. That would be a 3.
Ooh, well, your wife is keeping hope alive. That's really it's exciting though, and it's nice, especially sometimes when we're so divided in the country. It's so nice for all of us to be like Team USA, to really just have unity through diversity and to really push. It's a nice little kumbaya moment, if I should say so myself. It's also great watching the growth of the athletes. And I've been watching Simone Biles when she pulled out because of the twisties and because of some mental health issues. People were calling her the greatest quitter of all times. Shady people, everything that she had done, the greatest quitter of all time. But now all they can do is call her the GOAT and good night. So I'm loving that. But in that clip, they talked about how that water had all kinds of bacteria, E. coli, sewage, yet these swimmers whose bodies literally are their destinies, their bodies are what represent themselves, their bodies represent the country, their health is of the utmost importance for them to be about to go in that water that's contaminated. So that's one of the health hazards of the Paris Olympics. And when you think about E. coli, which you may have heard, because we certainly talk about it here on this Dr. Frita YouTube channel, please make sure you hit that subscribe button and the notification button, because we're forever talking about infections and other illnesses here. And we're up to almost 750,000 subscribers here on our YouTube channel. So thank you to everyone who supports. But yes, the E. coli infection not only can it cause an overwhelming infection in the body, it can cause sepsis or even a septic shock, which is when you can get organ failure. Okay. You can get heart failure. You can get kidney failure. You can get respiratory failure, fever. You can get altered mental status from a septic shock from a bug like E. coli. And if you're swimming in E. coli, you're breathing it in, drinking it in, all of that. But there's other sewage. I mean, literally imagine what is flushed down the toilet. That's what was contaminating that water that our most elite athletes were supposed to swim in. And I find, that again, the Olympics is so positive. Sometimes this not so wonderful, not so happy, these things don't often make the headlines. But y'all know me, if it's about health, I'm gonna find it in the headlines. And so, yes, that's one of the hazards. But there's some other hazards too, Shador. COVID, right? We know before the COVID put such a damper on the Olympics, and the athletes didn't have people out there cheering for them. Everyone was scared. There were so many lockdowns. And so it hasn't been talked about very much in the headlines, but we know, and we've talked about it here, that COVID is still on the rise. We've had a summer surge. No, I'm not trying to pretend like it's as severe as it was even in 2023. Certainly not as severe as it was in 2020, 2021. I'm not being that hyperbolic, but it still exists. People are still getting COVID. People still can die from COVID. And on the Australian water polo team, 5 of the women got COVID. And there were 7 people who got diagnosed as being positive for COVID in the Paris Olympics within 1 week. So COVID is still there. And so just one of the health hazards going on, because I know many of them are up to date on their vaccinations with COVID and all of that, but it's still there. And what else? There's some other illnesses that there have been concerns about. Dengue fever, okay, which is one of those mosquito-borne illnesses. And you can't pass it from person to person unless you're a pregnant mom. You can pass it to your unborn baby, but it's something that you get from a mosquito bite, and it can cause a hemorrhagic fever, a bleeding fever, and can be life-threatening. Even the flu, influenza, because if you think about it, we talk about the flu season here in the States, but when you go to other countries, okay, it might be their flu season. And so we have the mixing of countries, the mixing of illnesses. And so you may be vulnerable at a Paris Olympics. And so that's just one thing to think about. Put a 4 in the chat if when you're watching these Olympics, you sometimes think about the high risk of the infections they have. Is it me, or does anybody else sit up there and think, they're out here breathing, I hope they don't get COVID. What if they get the flu? Is it just me? Well, I'll put a 4 in my own chat. All right. Make sure you like this video, you share this video. And as we talk, if you have anything that you know that you might want to talk about one-on-one, like if you want a one-on-one consultation with me, or if you have a very specific question, then please check out my telehealth service. I do have a concierge telehealth service. We'll put that link here in the description. And what you do, you sign up. I give you an in-depth history because I'm going to ask you all the details, all the questions to be able to really help you, give you a second opinion, or just give you my one-on-one information, my medical information. And for those of you who are new to the channel, I am Dr. Frita. I'm a board-certified kidney doctor and high blood pressure doctor. I've also received board certifications in internal medicine, in pediatrics, and most recently, I'm become board certified in obesity medicine. So I like to talk about a lot. I give evidence-based medicine, so check that out, please. Nobody else is thinking about infections. It's just me, Shador. Anybody put a 4? Come on, y'all.
No, we have 2 4s.
Who? I got it.
DJ.
DJ, thank you.
DJ, that's my DJ.
DJ, DJ. That's my DJ.
And okay. Janetta also plays a 4.
Hi, Janetta. You know what, Janetta? Janetta, are you in health? I wonder if you're the Janetta I know and who I'm thinking of.
She is.
let me know. Were we on the shoot a call together? And just, well, you don't have to tell all your business, but yeah, but if you're the Janetta I'm thinking of, you're sitting up there, you're thinking about the germs and the infection control as well. But so far, it looks like it has not been a major outbreak, and the Paris Olympics have been going on without a hitch. So that's awesome. Now for the gaslight. Medical gaslighting. It seems, unfortunately, like an epidemic. Now, y'all know I love coming on here for Medical Mondays and talking about the hot health headlines, but sometimes these hot health topics in the headlines, I don't really like to talk about. And this is one I don't love, but I'll go ahead and stay true to it, because this is talking bad about the people in my profession, my colleagues, my fellow physicians. because apparently it seems as though there's an epidemic of gaslighting. People going to physicians, presenting very real symptoms, very real signs, very real problems, but being told, oh, it's something else, or oh, it's in your head, or people having their symptoms minimized. And so I want to, before we play this next clip, if you're someone who either feels like you have experienced medical gaslighting, or if you have a loved one or someone you know of who has experienced medical gaslighting, please share or just ask the question and kind of you give me a little blurb of what's going on, and I'll give you my opinion, at least just based on the information I have of what to do to make sure that you're not being a victim of being gaslit. So let's play this clip and we'll get into it.
Imagine visiting your doctor. You are terrified, you're in pain, you're tired to the point you can barely get out of bed, only to leave that doctor's appointment feeling dismissed, being told it's in your head. It's called medical gaslighting. And for women especially, it is an epidemic and the consequences could be deadly. Over the past few years, it's a topic which is all over social media. Look up the hashtag medical gaslighting after the show, not right now because we're talking.
I know that's right.
A million views on TikTok alone. We've been talking about this season after season. In fact, we have had on this show somewhere around 900 episodes. One of our highest rated ever was medical gaslighting. So many women, so many people reached out to us after this season 3. This beautiful woman here had a leakage coming from her brain. Doctors told her it was all in her head. We've had a beautiful woman on our show who texted her doctor after taking an at-home test to see if she had colon cancer. He replied with a smiley face and told her it was okay. She was diagnosed with cancer. This is an intense show, and Sharon Stone, Halle Berry, Selma Blair are all people revealing how they felt gaslit by doctors. They, you might say, are wealthy, they are famous, they have access, but they all say they experience the same thing. Doctors not listening.
That's a real thing. That's a real thing. So if you have a detailed kind of question or a scenario, or just something you want to share about being having experienced medical gaslighting, we'll get to that in the Q&A stage, but go ahead and put it on there. And again, we'll get to as many questions as we can, but we'll be prioritizing the ones that have super chats. If you really want it to be addressed today, then that's one way we guarantee that we'll get to it today. But other than that, without even necessarily going into a lot of detail, just put a 5 if you feel like you've experienced medical gaslighting, or if you know for sure, or know of someone who's experienced. Just go ahead and put a 5 there as we get ready to talk about it. So basically, the medical gaslighting is you go in, you have your symptoms, and you know something is wrong. That saying, your body, but you're told by the professionals, no, that's not it. Maybe you're just working too hard. Or are you depressed? Are you feeling sad? Maybe it's just stress. And it's tricky because yes, stress can definitely, cause some physical symptoms. Working too hard, having fatigue, all of these things can be caused by, not sleeping enough or being stressed out. But if you have doctors who are continuously telling you no, 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 and giving you no answers, then you may be a victim of medical gaslighting. We talked about it right here on this YouTube Live, where we talked about Halle Berry's story, where she went in because she was having very painful intercourse, and her doctor told her that it was the worst case of herpes that doctor had ever seen. Come to find out, she did not and does not have herpes, but instead she was perimenopausal, just experiencing dryness. But can you imagine just being told that you have a diagnosis, something that's very easily tested? You can test for herpes very easily, but just being outright told that, and what it is perimenopause. She's just one person. And then we know that Sharon Stone, have y'all watched Basic Instinct? I don't want to age myself, but put a 6 in the chat if y'all have seen Basic Instinct. She was great. And then put a 7 if you've seen Casino. I'm gonna forget these numbers, but those are 2 of my favorite movies. I love Sharon Stone. But she actually has had a brain tumor, and she has shared as far as being told, kind of, oh, it's in your head, or maybe you're just too tired. The medical gaslighting. I like it when celebrities come forward because it lets us know it's just not about, socioeconomic access all the time. And, all the people who Tamron Hall presented are all women, and we know that sometimes, yes, there can be some misogyny, and sometimes women can be seen as quote unquote hysterical, not taken seriously. It does happen to men as well, of course, but it's very important. And this is one of the main reasons why I do my presentations and I do the YouTube videos. We have well over 260 videos on this Dr. Frita YouTube channel with our almost 750,000 subscribers. And one of the main reasons is because on these videos, I give you information in layman's terms, and it allows you to go into a doctor, even if they try to, make it seem like your symptoms are no big deal. I arm you with knowledge so that you can take notes and you can advocate for yourself. Because when doctors hear certain buzzwords, or they know that you've been looking at reputable sources to find out about your symptoms, the squeaky wheel gets the oil, and you're less likely to be dismissed. You're less likely to be dismissed. So arm yourself with knowledge, be your own advocate, and understand, even though the doctor has the degree, the MD, or however many degrees, and you don't, that doesn't make the doctor better than you. It just means that they're in a specialty where they are supposed to help you. It is their job to help you. But guess what? It's also your job to help yourself and to advocate for yourself and for your loved ones. Okay. So, all right. Has anybody watch Basic Instinct with that 6 or Casino with the 7? Now those are my
a lot
two.
of 6s, a lot of 7s out the Frita. You're not the only one.
Okay, well, good. All right. Oh, just give me a couple 6s. Who watched
couple 6s, of course.
DJ, go DJ. That's my okay, good DJ.
Aline had 6 and 7.
I know that's right. Okay.
Lady Centrist with a 6.
Which one? With the 6?
With a 6, yeah.
See, and and Sharon Stone knows she was wrong for that movie. There was all that controversial scene, the crossing the leg scene. But then Casino, okay, I'm gonna tell y'all this. I'm gonna keep moving. Y'all know I get off topic a little bit. I did not have cable in medical school. I went to Meharry Medical College, historically Black college university, medical school, Meharry Medical. And I didn't have college because I really felt like I didn't have business watching a lot of TV, and we didn't have all of the streaming and all that stuff that your young folks have. But what I did have was a VCR in one of those old big box TVs. No, I didn't have a flat screen. And I had Casino, and that was one of the movies that I watched. I also had Goodfellas, and those were the movies. That's what I watched. And that's what entertained me. And so I probably have watched Casino, I don't know how many dozens and dozens of times, but okay, that's just a little small fact. All right. So yeah, so Halle Berry shared her gaslighting story. Sharon Stone shared hers. And then if you watch that Tamron Hall episode, there's that one lady who shared that her brain had the leakage, but she kept being told that there was nothing to it. And in our office, and y'all know Shador as my practice manager, you see it where we get a lot of people who come in for second opinions, even on these concierge visits. Largely these concierge visits, I have people coming and they say, I have these symptoms. My doctor told me, it's okay. And it's just because I'm getting older. And I have made some diagnoses. I'm like, that's not just because you're getting older. That's because of this disease or that disease. And so the gaslighting is a real thing. I say that to say, if you know that something's going on with you, it is within your right to get a second opinion, and don't just, kind of sit and say, well, I know I'm in pain. Well, I know I'm having this bleeding. Well, I know I'm dizzy, but the doctor said nothing's wrong. Advocate for yourself and keep pushing. Yeah, because the medical gaslighting is apparently something that is a bit of an epidemic. But again, if you have anything where you feel like you've had any medical gaslighting, or if you know of a loved one and you want to ask a question about it, then please do. And, it's something, isn't it?
Mm-hmm.
Yeah.
So no question, Dr. Frita, but we do have a comment from Jacqueline, who's experienced it. Hi, Jacqueline.
Hi, Jacqueline.
So Jacqueline says, it took 15 years for me to be diagnosed with lupus. I had pericarditis, spontaneous collapsed lung, and a stroke before getting diagnosed.
Now that's a mess. That's a mess. But unfortunately, Jacqueline, and I'm glad that you got diagnosed. I'm sorry that you have to live with this very tricky and oftentimes devastating disease. But lupus is one of the ones that Tamron Hall talked about on her show, where many women who are showing up with these symptoms, they're told that it's in their head, or that they're, hysterical, or the hypochondriacs. Lupus is a big one. And because lupus is one of these illnesses that can affect pretty much any system, then if someone can literally come in, like what you just described, is having all these different things, they can say, my hair is falling out and I'm fatigued and I have blood in my urine, and I have a rash, and my joints hurt. They're naming all of these symptoms, and they can be told, okay, she's making that up because no one can really have this many things going on with that many symptoms. But that's exactly what lupus is. And, and for everyone in the chat, lupus is one of these autoimmune diseases where your body's immune system, instead of just fighting bacteria, viruses, germs the way it's supposed to, your immune system turns on you, okay, and it starts fighting yourself. The same way an autobiography is a book about oneself. Lupus is when your antibodies attack oneself. And so, yes, lupus can cause that pericarditis. I'm sorry that you've had to go through. And you'll recall we talked about it here on this live, that Toni Braxton is living with lupus. She had pericarditis, and I believe she said it took her 7 years to get diagnosed. And again, someone who's a celebrity who has access. And so the phenomenon can really hit anyone, the medical gaslighting. Lupus can certainly cause lung disease, as you've mentioned. Lupus can cause kidney failure. It's a big reason why I see young women, especially. It can happen to men and women. It happens more often in women, young women of childbearing age, than in men. It's a big reason why I have women on dialysis or with kidney failure. They get lupus nephritis, okay? Lupus can also cause rash, can cause that classic butterfly rash right around your face, like kind of right around the cheekbones and above the nose. There can be a redness or a darkness, a hyperpigmentation, almost like a butterfly shape. They call it a butterfly rash. It can also cause other rashes in the body. You can get discoid lupus. And, we have the Trick Daddy is a man who has lupus. Now, Trick Daddy used to admit that he was not taking his medicine the way he was supposed to. I don't know what Trick Daddy's doing now, but he was not taking his medicine. He shared that out of his own mouth, but he's someone who had lupus. And it can cause your hair to fall out. You can get lupus cerebritis. I actually have a video right here on this Dr. Frita YouTube channel. I want you to check it out after you finish watching this live on Lupus Explained, where I go into detail about lupus. But thank you for sharing. But yeah, that's a big one that can make people victims of medical gaslighting. Yeah. All right. Make sure you like this live. Please like this live, share this live. Go ahead, hit that share button, take that link, copy it, put it in your group chat, in the family chat. Go ahead, hit that link, go on over to your other social media platforms. Tell people we're here. We're giving evidence-based information. And if they catch us before we're over, they can get their questions answered live and on stage, because we have our live Q&A coming up at the end. All right. So let's get into this next story. But before we do, I'll tell you, the next story we're talking about mental health, okay, mental wellness, which of course, week to week, we're talking about Medical Mondays, how to live your healthiest, happiest lives. But one thing I always like to remind you of is that, hey, I have a freebie for you. I'm giving you something for free 99. And what it is it is a PDF on 10 healthy habits for a better you and a better life, where I talk about ways to have not only good physical health, but good mental health. Starting your morning off drinking lemon water. And I go into how lemon is loaded with vitamin C, citrate, things of that nature. I talk about, positive self-affirmations, exercise, just a nice, quick little checklist that if you do it, and if you do it consistently, it is a way to help to better your life. So make sure you go ahead and check out this free PDF before you leave this live. So speaking of mental health, let's talk about Pete Davidson, shall we? We know that he's a comedian, actor. He's been on Saturday Night Live. He's had some famous love interests. Y'all know about Kim Kardashian. Well, let's see what he's up to.
Pete Davidson is reportedly taking a step out of the spotlight to prioritize his health. According to People magazine, the comedian has checked into a wellness facility for his mental health. A source told the outlet that mental health has, quote, always been a priority for Pete, adding that he's also been focused on his sobriety and that his loved ones are happy that he's kept taking care of himself. The report comes as Pete has been on the road on his prehab stand-up comedy tour this summer. Multiple venues in Florida, New Jersey, and Pennsylvania announced this week that his upcoming tour stops have been canceled due to scheduling conflicts. Access Hollywood has reached out to reps for the former Saturday Night Live star for comment. Pete has long been open about his sobriety journey and his mental health, including his experiences navigating borderline personality disorder and post-traumatic stress disorder. He last sought treatment in June of 2023. Page 6 reported at the time that Pete was receiving inpatient therapy to address issues related to his BPD and PTSD. A source told People magazine at the time, Pete will often check himself into rehab to work on these issues. His friends and family have been supportive during this time. In September of that year, Pete worked his treatment experience into a stand-up set in Atlantic City, telling the crowd, I am fresh out of rehab, everyone. I got that post-rehab glow. 7th time's the charm. He reportedly also revealed during that set that he had taken ketamine for 4 years before his time in rehab. The then 29-year-old then suggested that he was turning a new leaf in his new decade, quipping that he believes you, quote, can't do drugs in your 30s because, quote, it's not cute anymore, and at that point, quote, you're just a drug addict. When Pete performed again in Atlantic City earlier this month, he revealed to the crowd that he now only smokes weed, having quit other substance use. During that same stand-up show, he also addressed his reckless driving charge getting dismissed after he allegedly crashed his car into a Beverly Hills home last year. Pete told the crowd he recently finished his hours of community service and said of the moment he learned his charge had been dismissed, per the Daily Mail, hooray, I guess. I did something bad. It's not anything really to be celebrated.
I really like how he ended that when he talked about that charge being dismissed, but then he said, hooray, I guess, but I did something bad. To me, that shows accountability, because of course I know he has the resources, right? Shador, the lawyer, but he still could have killed someone. He could have killed himself, so I like that accountability piece where he says, I did something bad. So Pete Davidson. Yeah. So, we know that he had the famous relationship with Kim Kardashian, where it seemed like he was kind of trolling Kanye West because he would be sending him pictures reportedly of Pete Davidson. He's like, hey, I'm over here with your ex-wife, or he's, riding around with his kids, even had Kanye's and Kim's kids tattooed on him or their names tattooed on him. So he was kind of trolling Kanye. I think he was, but they had their relationship. And of course, with Ariana Grande, he dated her. And with this most recent checking into a wellness center for his mental health, he's busy with Saturday Night Live. He had a very busy tour as far as his stand-up comedy. He's got his second Netflix special coming out. A lot of stressors, that can be mental stressors. And he reportedly has been in, mental institutions or getting professional mental health, even as an inpatient from the age of 9. And historically, he had the diagnosis of anxiety, of depression, which we've talked about quite a bit here on this live, where anxiety, it's normal to feel anxious sometimes. Okay, when you have a little worry, you're about to give a speech. Ooh, am I going to mess up? Your kid's first day and your kid's going off to college. Is she going to be okay? Having that worry. To a degree, that's normal. Okay, I'll calm down. But if you're having worry that just really is not logical, you're sitting here just worried about things that are not likely to happen. If you won't go outside because you're scared an airplane is going to fall out of the sky, or you absolutely won't pass anywhere where there's a tree because there's a possibility, or if you never, ever leave your house because just in case, there's a tornado that pops up out of nowhere. And if the worry keeps you from being able to function in day-to-day life, if it's causing that kind of stress, that kind of anxiety could be generalized anxiety disorder. Make sure you check out my video here on this Dr. Frita YouTube channel on anxiety disorders. And then of course, depression. Everyone feels sad sometimes. Everyone has low moods. And so there are times when sadness is what we deem as appropriate. But if you're sad to the point where you get the inability to experience pleasure, if you have changes in eating habit, either eating too much or much more than what's normal for you, or not eating enough, that can be a sign of a symptom of depression. If you are having sleep issues where, again, you're having insomnia, where you're up, you're not going to sleep, or you're having hypersomnolence where you're sleeping all of the time, this could be, again, depression. If you have a change where you're someone who used to care about putting on your red lipstick and trying to make yourself look some kind of way, but now you don't care, you don't bathe, won't bathe, you're disheveled, different symptoms, and specifically if you have a certain set of symptoms for 2 weeks, at least 2 weeks, then that could be consistent with having major depressive disorder. And, he's had that diagnosis. But most recently, Shador, it's been the PTSD, post-traumatic stress disorder, as well as borderline personality disorder. And I do talk about PTSD again on this video. So if you, go to the YouTube, go to the search part and put in Dr. Frita and put in PTSD, or put in, again, the anxiety disorders, which PTSD is one of the anxiety disorders. I talk about it here. But if you or a loved one is dealing with mental health issues, make sure you take it very seriously. Don't just pass it off and tell them, hey, go be strong. And certainly, if you have someone who is thinking about hurting themselves, you want to, reach out to one of these health, these hotlines that are available, lifelines, Google a lifelines, life or crisis helplines, and there are different ways to get help, but definitely take the mental health seriously. And put an 8 in the chat if you want me to go into more detail. I could do one of these short form contents either on PTSD borderline personality disorder, or both. If I see any 8s in the chat, then I'll get that out there for you in the near future. All right. So now for the favorite part, my favorite part of the lives. It's the live Q&A. So make sure you go ahead and ask me questions. You can ask anything about what we've talked about, the Listeria, okay, that foodborne infection, or the Paris Olympics as far as the health hazards there. Medical gaslighting. Definitely you can ask me about medical gaslighting. And if you think that you've been experiencing medical gaslighting, and some of the mental health things. And so we'll get to some of these questions. Shador will pick out some questions for us. And we've been getting folks who've been frustrated, and I've been getting things in the back channels about, hey, you didn't answer my question. Why didn't you get to my question? We can't get to all of the questions, but if you want your question, a surefire way to make sure we get to your question is to put a super chat in. Otherwise, we will pick and choose and see. Well, Shador will. All right. So do we have any questions, Shador? Oh, and you can always ask questions about kidney disease, of course. Again, I'm a board certified kidney doctor. So anything kidneys, high blood pressure, I'm always on. I always want a kidney question. All right, what do we have?
This is from Patrick. Hi, Patrick.
Hi, Patrick.
Wow. So Patrick says, before I ask my question, I don't know if you heard us before, Dr. Fish. He said, I feel I have to apologize to you both after what happened to Sonia Massey. Did you hear about her?
Yes. So
he just wanted to apologize. Throw that out there. Here's his question. If my mom had breast cancer, can my doctor recommend a mammogram for me, even though I'm a man?
Okay. So I'll definitely answer your question, Patrick. And thank you for the acknowledgement of Sonia Massey. If you have not heard of her, please do take the time to look her up and to say her name. Lovely young lady in her 30s, Black female. She called on the police because she felt like she might have an intruder around her house. So she called on them to help to keep her safe, to protect her. And when they got there, one of the video cam is there. Okay, you can watch all of it. Absolutely, the body cam is there from one of the policemen. But he actually instructed her to go over to where there was boiling water. She had a pot of boiling water. But then when she went to get it, things changed, and he started verbalizing as if he thought she were trying to assault him. Mind you, the body cam, the other policeman's body cam was on, so we know that he was just pretty much crying wolf. And he set it up so that he would be able to shoot her, he thought, where it would seem like self-defense. And she said that she rebuked him in the name of Jesus. She ducked down. She tried to protect herself. He went around and he shot her. He shot her in the head and neck area, and he killed her. And so he is now in jail. He is charged with murder. He's being relieved of his duties for murdering this Black female. Suppose I should say allegedly, but it's right there on tape. We've got the audio, we've got the visual. Apparently the one who actually shot her turned his body cam off, but the other policeman's body cam was on. And so we have the full visual of this Black woman being killed by the very policeman she called upon to protect and to serve her. So yes. All right, thank you for that acknowledgement. Now, for the breast cancer. So Patrick, I'm sorry that your mother's been diagnosed with breast cancer, and I certainly hope that she's getting all of her proper care and her treatments, and I hope that she does well. As far as you and being screened, things are a little different for men. Now, yes, men most certainly can get breast cancer, and as far as the general population, 1 out of every 100 cases of breast cancer is in a man. With your mother having breast cancer, that very well theoretically could increase your chances for getting it. Still, we don't have the standard recommendations of men getting yearly or every other yearly mammograms no later than the age of 40. We don't have that. But with your family history, I would start by going to see your primary care physician, because fortunately with men, because you don't have the same amount of breast tissue, the breast cancer can be a little bit easier to detect once you are in the mindset of checking. For men, the signs and symptoms may include having bloody discharge from the nipple, having a nipple that becomes almost scaly, like a lizard skin, or like eczema, so a change in the nipple, certainly having a mass. It's recommended that you do self-breast exams, especially having a family history with your mom, where you literally start around the nipple and you go around and you feel all around the breast chest tissue, all the way into the underarm area where there's also breast tissue. If there's any kind of discharge from the nipple, be it bloody discharge, milky discharge, all of these should caution you, should be a red light on it possibly being breast cancer. And they can make a decision on if they actually do a mammogram which most men, many men may not have enough tissue to actually do an effective mammogram, but they may need to do an ultrasound or even an MRI. But certainly I recommend, Patrick, that you go into your doctor, let your doctor know the family history so you can be thoroughly examined. And from that exam, they can determine if they need to, if it's recommended that they do any kind of imaging, or if they do any testing, like test you for the BRCA1, BRCA2 genes. But that's a good question. And I pray your mother does well and that you do well. Thank you for your question.
Thank you, Patrick. Next question comes from I Stay in Stilettos.
Oh, I stay in stilettos. Good morning. All right. What's your question?
Can people recover from major mental illnesses without medication?
Can people recover from major mental illnesses without medications? So the short answer, just, if it's a true or false, yes or no, the short answer would be yes, that it certainly is possible. There are different mental illnesses. Some mental illnesses are triggered by something specific. For example, you can have a situational depression where you're meeting all the criteria for major depressive disorder, and it's, but it's because of a specific situation, a death, a major loss. And it's possible, even without medication, that as time goes on and as you get counseling or whatever coping is necessary, it is possible that you could get better from that without medications. That's for some people. The other side of that is that mental illness is often chemical, okay? It has something to do with your biochemistry. You may be someone who literally is not producing enough serotonin or dopamine. That's why there are certain medications called selective serotonin reuptake inhibitors, SSRIs, like Zoloft, Lexapro. These are medications that help to keep the serotonin up in your body so that you're not depressed. So there's some people where it can literally be something that is physical and chemical, in which case a chemical medication can help. Now, for different illnesses such as bipolar, for example, bipolar 1, bipolar 2, especially bipolar 1, we're dealing where, again, there's often a chemical imbalance, okay? It's not the same way that people with diabetes is something physical, that people with cancer is something physical. Even though it's called a mental illness, we're dealing with something physical oftentimes in bipolar, where the medications really will help. And some people, though they may do all of the meditation and all the things to decrease the stress, they can get that chemical imbalance, and medications really can be necessary. And certainly with schizophrenia, I will say that in my career, in the people I know who have the diagnosis of schizophrenia, it is very rare, if ever, that I see someone who is really fully, properly managed with an actual diagnosis of schizophrenia if they're not taking medicines. And I do have patients, I know of patients who don't take the medicines, and it's often very obvious and very evident that medications will help them. So the short answer, is it possible at all? Yes. But I really urge you to consult with your whoever it is you're talking about, a loved one or a friend, or if you're just curious, if there's someone that you know of and anyone listening in the chat, any of the med heads, consult with your physician, consult with your mental health provider, specifically a psychiatrist if you have a diagnosis that often requires medication, to make sure that you make those decisions in conjunction with the mental health care provider. Because the last thing you want to do is to just stop the medications and then end up having a mental issue that can cause you major problems, be it mentally or even physically, and making poor decisions. Good question.
Very good. All right, now lead with this one. This is from DP.
Hi, D. Oh, DP. Hi.
Yeah, Dark Pisces. What do I do if I feel I have been misdiagnosed with something? It's in my medical records, and any new doctor I go to automatically refers to that, even though I feel it is wrong.
Okay. So that is a very general question to which I would give a general answer. But if you want to know my specific answer for whatever that specific diagnosis is, then I recommend that you click the link in the description and you come check us out for the telehealth, where it's one-on-one. It would just be you and me, where I can really, help to give you a specific answer. But in general, you do have a right to your medical records, and when you go in and you see a doctor and they give you all the paperwork, you want to make sure that you read carefully and or ask about your rights to your medical records. If you see something in your medical record and you feel like it is a misdiagnosis, if it's something that is, that is physical or chemical where there's actually a blood work test that can line it up, then that's a bit of that is a bit more simple. For example, if someone is saying that you have hepatitis and you don't think you do, then you simply say, show me my blood work that has hepatitis, or you request a repeat hepatitis panel so you can show that it's not there. And then you have something really to stand on to get it off of your chart. Now, if someone is giving you a mental health diagnosis, for example, like if they're saying that you have depression, then again, you can advocate for yourself and you could be like, hey, document it. What makes you say that? Do I have the 2 weeks of this amount of symptoms, going on for this long, and I'm feeling depressed more days than not, or if you think there should be a modification, you can be like, okay, I was sad then, but I had, a major death in my family. Can you please adjust this to saying that it was situational? Bottom line, I would get the medical record, find out what that diagnosis is, and if it's something where there is a concrete yes or no, black or white box for a blood work. And if not, then it gets a little bit more complex, but I'll be happy to talk to you about that, because there's really nothing worse than someone having something where you feel like it's a label or a stigma if you feel like it's not true. And you know what, in that Tamron Hall episode, the lady who actually had, one of the ladies who had a diagnosis, and she kept being told that was in her head, and she'd seen like 6 doctors. They said that she had an anxious presentation, pretty much trying to make it seem like she was hysterical. And that's in her chart. And she said she's been trying to get it out and she can't get it out of her chart, because in that case, it's really, I guess, the physician's opinion, but it is kind of code language where they're trying to tell other doctors, she's a little off, she's hyper, she's anxious, So, but yeah, it's really going to depend specifically on what that diagnosis is. And I could try to help you work through that to see what we could do to get it off of your chart. Thank you for that question.
Yeah, thank you. Then 2 more and I'll be at Dr. Fisher. This is from Ross.
Okay.
Hi, Ross. During an MRI and while looking for something else, doctors found a nodule on my adrenals. I'm being told we can just keep a watch on it. Is that enough?
Okay. Now, of course, what I give you here is medical information. It does not replace the advice of your physicians. And I say that because for your physicians to say, let's watch it, that means that there's a few things. One, when they saw the nodule on your adrenals, they probably thought that it looked benign, meaning it probably looked nice and smooth around the edges. It didn't have spiculations or a lot of irregular borders. It didn't look very spiky. It probably looked smooth. And they may have checked certain tests to see if you had certain hormones that are produced by the adrenal glands. Perhaps they checked those tests and they found that they weren't out of the ordinary. And there are certain things called incidentalomas, meaning you're looking for one thing and then incidentally you find this adenoma, and it can be benign. And so it is possible, depending on what your physicians have done, what tests they've seen, what symptoms you have or don't have, where they can have you come back and do a repeat in 6 months and 3 months. So it is possible that they gave you the right information. But again, they have information that I don't have. So I would actually go and I would ask them the questions. I would say, 1, why do you think we can just watch and wait? Have you done any tests that make you not suspicious that I had? Have you done tests where you're not, that help you to not be suspicious? In other words, why do you feel so confident that it's not cancer? If we're going to watch and wait, when are we going to watch? Am I doing a repeat MRI in 3 months? Am I doing one in 6 months? Am I going to wait a year? Why? What's the evidence? I would go back with my questions very specifically lined up. If it is cancer and we wait, what are the downsides? If we take it out and it's benign, then, what are the pros? What are the cons? So I would go and ask your doctor those questions specifically, but I will say I've had cases of patients who have had nodules on their adrenal glands and we've done a watch and wait, but I do have a definite reason in the testing that I've done. And I have a plan on when I'm going to repeat the imaging to make sure that it hasn't grown. Because if it is truly just benign, I expect it to stay the same size and to mind its business. But if I see it growing, changing in the shape or pattern, then I know it's badness. But yeah, go back and ask those very specific questions. But it is possible that they're giving you the right information.
All right. Thank you for that question, Ross. And then I stand stilettos. We'll go with your question. What kind of physical symptoms can low ferritin cause?
I'm sorry, what kind of what now?
Symptoms can low ferritin cause if your iron levels
are low. Yes. Okay. So ferritin is, so when you get checked for anemia, okay, and so if you are listening and you're looking at your labs, then they'll do the hemoglobin, the CBC, okay, the complete blood count. You'll have WCs for white blood cells. you'll have HGB or your hemoglobin, hematocrit, all of that. So the hemoglobin and hematocrit are what let us know whether or not, just in general, you have anemia or low blood. If your doctor's trying to find out if you have iron deficiency anemia, then they'll check for iron level, iron saturation, or ferritin. The ferritin lets us know your iron stores, okay? Your iron stores. If you have low ferritin, then you could have iron deficiency anemia. So it can give you all kinds of signs. One, you can have low energy, okay? You can have fatigue. You can also have shortness of breath. You can have, as a sign, when your doctors look at your red blood cells, you may have a microcytosis or microcytic anemia, meaning you have little bitty tiny red blood cells. So if you look at the MCV, it might be small. And it's very important to find out why. So if you have the low ferritin, you want to know why. You know, if you are a woman, is it because you are having heavy menstrual cycles? If you are a woman or a man or other, is it because you're having a stomach bleed? And you can have a stomach bleed even if you don't see blood in your stool. Okay, you can have what they call occult blood, meaning the stool still looks brown, but there's hidden blood. We have ways to test for that. And that can be caused by peptic ulcer disease. It can be caused if you have a polyp in your intestines. It can be caused from cancer. It can be caused from issues in the esophagus. So yes, those are some of the symptoms that we talked about from ferritin, having iron deficiency. And then the very important thing to do is to find out the cause or the source. Why are you losing the iron?
All right. Thank you, Dr. Frita.
And thank you for that question.
A question, number 8, if you should do a shorts regarding PTSD and or other. So you got a few 8s in the chat.
Okay. Yeah, so the PTSD, I think a lot of people have it and don't even realize that they have it. And also, he has borderline personality disorder. That's not something we talk about that much. All right, so I'll get that into the works over the next in the next week and see what we can come up with for the PTSD, borderline personality disorder. We'll talk about Pete Davidson, and and I always appreciate the celebrities who put themselves out there and let us know that even the rich, the famous, those with access have problems too. They're people just like us. All right. So I thank everyone for joining us here on our Medical Monday, where we talk about all of the hot health topics in the headlines. We covered some pretty good ones today. Paris Olympics, the medical gaslighting, the deli meat. Oh my goodness. And the Listeria infections. And of course, Pete Davidson with the PTSD and the borderline personality. So please make sure, again, on your way out the door, like this video and share it with the people you care about. And if you haven't done so already, do make sure that you subscribe to my YouTube channel. We're up to almost 750,000. And look, and if y'all do the thing, y'all can help us get to 750 before we get off the live. But we have, almost 750,000 subscribers, well over 260 videos, more. And for many of the topics that we talked about from live to live, I guarantee you I have videos right there. Because even with some of the illnesses I was talking about, like COVID, and that being one of the scares for Paris Olympics, I've got COVID video. For measles is another one. Measles is another fear of an outbreak that, a lot of people, especially people who are unvaccinated, are more likely to have measles. If you are not vaccinated against measles, then you have a 90% of getting it if you're exposed to it. And measles can hang around in the air for 2 hours. So you can walk into an elevator, nobody's there. You be like, oh, you breathe in, you breathe out. You can get their measles, but I have a video on that too. And if you're one of the people who thinks that MMR causes autism, it doesn't. But check out my video on the truth about vaccines. I talk about that too. I talk about it all, but make sure you check that out. Follow me on Instagram. I have different content there than I have here. Follow me on Facebook. Follow me on TikTok. And definitely follow me next week, where we'll be back for another Medical Monday with all the hot health topics in the headlines. Thank you, Shador, my wonderful co-host and practice manager. And I want y'all to do y'all best to live your healthiest, happiest lives. And we'll see you next Monday.